Hi, I'm Jim Porter, and I'm the exposure guy. I'm a licensed mental health counselor in Florida, and I like to talk about my favorite form of therapy that is called exposure therapy. Exposure therapy can be used for many disorders, but I'm going to try explaining it today by using OCD as an example. So OCD is Obsessive Compulsive Disorder, and the exposure therapy technique is based on the fact that there's something that your mind and body are automatically avoiding. It's not a mystical thing. It has to do with neurology. You have an autonomic nervous system that gets you functioning in autopilot, that actually gets you able to ride a bicycle without even thinking about what you're doing and that kind of thing. But it also gets you to do some ridiculous things without even being able to think about them. And even when you do think about them, your thinking brain, say your more prefrontal cortex, your executive functions, the one that makes decisions and you think of as sort of the you that makes decisions, can't take over because the autonomic nervous system is trained to put you into this mode. So, how is it trained? It's trained by associating things to fear, for example, especially in the case of OCD. So OCD is Obsessive Compulsive Disorder, and compulsive means you have a compulsion. And a compulsion is a behavior or a thought that you can't seem to stop repeating, like repetitive hand washing, or repetitive counting in your mind. So repetitive hand washing is a behavior, and repetitive counting is a thought compulsion. And then an obsession is a horrifying fear that keeps repeating in your mind. And so sometimes it's a very vivid, horrible, repeating same fear over and over again, something very specific, like I'm going to go out and slash somebody's throat tonight. I'm going to go out and slash somebody's throat tonight. And you get these terrible images and you can't go to sleep and all that kind of thing. It can also be another example of an obsession would be I'm constantly thinking about how the world could end at any moment. I'm constantly thinking about how the world could end at any moment. I'm constantly thinking about how the world could end at any moment. So that is an obsessive thought. Now, what's interesting about an obsession is it's just disturbing. Like if you tell somebody about it, they'll say that's a scary, icky, or disturbing thought. A compulsive thought and a compulsive behavior are intended to comfort you or distract you from something that's bothering you. Oftentimes what's bothering you is an obsession. I'm going to broaden, for the purposes of this video, I'm going to broaden the concept of what an obsession is to not just one repeated thought like the world's going to end sometime this month, the world's going to end sometime this month, to you could be obsessively worried about a lot of things. So it could be your mind gets in the habit of conjuring negative images for you of all kinds. And I'm going to go ahead and call that obsessing. You could call it racing thoughts, extreme worried, stinking thinking, horror show creations, and that sort of thing. But I'm just going to also call that a form of obsession. Now, why would your mind do either of these things? First of all, the reason your mind does an obsession is because you have emotional states. And somewhere along the line, you actually, because of some experience you had, or several experiences, or a series of experiences, you associated those emotional states with something really, really, really bad happening. Maybe your parents screamed at you and hit you. Maybe you were sexually molested. Maybe you were neglected to the point of great emotional or physical pain. And those things can lock into your nervous system because your nervous system just decides that this is going to happen again. So when the feeling comes up, that autonomic nervous system believes that the danger is happening, that the feeling means the danger is actually happening. So that's why obsessions come up, because it's constantly warning you, trying to get you to do anything you can to avoid the danger by avoiding the thought and the feeling. And when you do that, you reward yourself for avoiding the thought. but you didn't cure the compulsion. It still believes things are dangerous. I'll tell you in a second what exposure therapy is and how that actually helps with obsessions. Now, compulsions are different. They are there, I said, to distract you from scary things. And so you can say that they are there to distract you from obsessions, that there's a horrifying fear behind every compulsion. And so if you're compulsively counting, you're distracting yourself from that horrifying fear. If you're compulsively praying, you're distracting yourself from that horrifying fear. And if you're compulsively hand washing, you're distracting yourself from maybe some bacterial fear. If you're compulsively checking your alarm clock 52 times at night before you can go to sleep, you're obsessing about some horrible thing that could happen if you don't get up on time. And it's usually a horrifying fear in the back. So both of these involve avoidance. The compulsion helps you avoid, say, an obsession in my broad definition. And the obsession just trains you to find some kind of way to avoiding, which may not be a compulsion. It may be just distracting yourself or whatever. And I might even start to call those compulsive because you impulsively do something just for the temporary, immediate reward of getting relief from your pain. So I'm going to say compulsions are there to block obsessions, but they don't cure the obsessions because you haven't taught your autonomic nervous system that the obsessions are lies. So here's how exposure therapy works. First of all, let's talk about an obsession. You've got a terrible thought. Now, with the guidance of a trained professional who really likes to do exposure therapy and has done it with many, many clients and has a structured way of doing it, creating a safe space before you do it, you explain your obsession to your counselor. Then your counselor will get you set up to do the exposure. The one principle of exposure that I think is most important to me is that all exposure therapy is 100% voluntary, and it needs to be as controlled as possible in most situations. A secondary thing is that there probably needs to be a cool down period before and after. And a third thing is that you want to be able to constantly be aware of how extreme your emotional state is getting. And your plan is to not quit no matter how uncomfortable and excruciating it gets. So here's what happens with an obsession. Your counselor will ask you or guide you through your obsession story in more and more vivid detail, possibly guiding you to add, or your counselor, him or herself, adding worse elements to the story, making your obsession worse than ever. And what that does is it ramps up your anxiety, that horrible feeling right there. You're sitting in the chair or the couch in your therapist's office. You know that nothing can bother you. You know this is private and your therapist has created a safe space, but your autonomic nervous system is screaming at you to stop doing this to yourself. Why are you remembering this crazy story? And if you listen to that and obey it, it's like listening and obeying to a toddler. So instead of listening and obeying it, you keep obeying your choice, which is the executive function brain, which is right up here, the prefrontal cortex. And after a while, A, your anxiety system can burn out. And B, most importantly, your autonomic nervous system experiences the extreme stress and strain and pain and discomfort that comes with you intentionally remembering the story and augmenting it. And it realizes, because it's smart enough to realize this, especially after a few repetitions of this exposure, that nothing bad actually happened. So it learns a new lesson and unlearns an old lesson. The new lesson it learns is that pain and fear do not necessarily mean something dangerous is actually happening or about to happen. And what it unlearns is that link that was caused a long time ago between what we call autonomic arousal, which means your autonomic nervous system is stimulated, between that and some sort of external reality that is no longer happening, but your brain assumes it's happening, or it's going to happen, or something just as bad is going to happen. So that's how you deal with an obsession. You force yourself to remember it. There's a part of you that forces the other part of you to put up with remembering it. Compulsions are very similar. What you want to do is just stop the compulsion. And really bad things will come up because the compulsion is hiding the bad thoughts and emotions. So if you don't do your behavioral compulsion, then you're going to get uncomfortable. And you do that until it burns out, or until you've accomplished a task despite the fear, or until a timer goes off that you've set. That goes with obsessions too. And then your system will learn that horrible fear that comes up when you stop your compulsion doesn't mean that something's actually going to happen, and you extinguish this fear response. And so what happens, the reason the fear is so intense is because your obsessive compulsive system doesn't tolerate a little bit of fear. It just shouts at you more, increasing your fear. So that's with a physical compulsion. It's easy to stop a physical compulsion because you can watch it. You can say, don't wash your hands. Don't check your clock tonight. Just go to bed. And if you can't sleep, just stay up all night because you're trying to cure a disease here. With a mental compulsion, it's very different, because how can you tell that you are blocking the compulsion that's inside your head? And how can your therapist tell? Well, the way you do it is you do it through some kind of verbal behavior, and it's best, some kind of visible behavior, and it's best if it's a verbal behavior because you're going to interrupt it with a thought. Now, you can choose some kind of benign thought just to interrupt it, and that can get you anxious and freaked out. And that can block the compulsion, and that will teach your autonomic nervous system again that whatever you are doing to block your mind from having the compulsion, the mental compulsion, the thought run through it, is okay to do. That not having the compulsive thought is fine. It's just very painful, but it gets less and less painful with each exposure. Another thing to do is, instead of just getting some random thought to do out loud to block the compulsion, is to try to determine what the fear, the obsession, the impulsive, horrible thought that keeps popping up, or set of thoughts that come up, and try to use that. And so perhaps what you might do is write out the worst case scenario fear. And then you read that over and over again till your mind is sweating with horror. And when you're done, you repeat that over the course of several sessions with your therapist, and you will extinguish the obsession or the horrible thought behind it and the compulsion that's trying to protect you from it. Because if you're tired of counting all the time, or doing weird rituals, going up and down stairs, checking that the door's locked 15 times, having to tap your glass 5 times before you drink it, brushing your teeth 15 times a day, taking a shower continuously all day, then it's worth getting rid of the compulsion. So that's it. I'm very passionate about the concept of exposure therapy because I think most of our problems are caused by avoidance and hiding. And in order to get anything in life, we need to go out and be seen to get the things we need. Again, I'm Jim Porter. I'm a mental health counselor in Gainesville. You can come see me if you live in Gainesville. What I'd like you to do, if you don't mind, is below in the comments, write any experiences that you seem to have with compulsions or obsessions, and tell me if you've gotten any help that has worked for you.